A very good evening to all of you. Thank you very much for joining with us for this online lecture. As you all know, we are starting off a new lecture series, which is on dental implants. So today we have our guest lecturer, Professor Nadeena Jayasooriya. Now, in the context of dental implants, I'm sure as dental surgeons, we all are very curious to master the skill of dental implants. However, at the moment, we need to upgrade ourselves mainly with the knowledge and then with the skills. So the objective of this lecture series is to give you an idea on the fundamentals of dental implants and to make sure that you are enthusiastic about doing dental implants in your private sector or in the public sector, if provided that all the facilities are available. So without further ado, I'd like to invite our guest lecturer today, Professor Nadeena Jayasooriya. He's a well-known lecturer, and the undergraduates uh, are very much eager to learn from him because of the style of his lecturing, as well as currently he's heading the Department of Oral and Maxillofacial Surgery in the Faculty of Dental Sciences, University of Peradeniya. So without further ado, I'd like to invite Professor Nadeena Jayasooriya. Thank you very much, sir, for accepting our invitation to go along with the lecture.
Thank you, Kemia, and good evening to everyone. So I'll start sharing the screen. Just let me know whether you can see this. You can see that?
Yes, sir, it's easy. Yes.
And it's clear, no? Yeah. So yes, thank you very much for the organizers for inviting me and taking this important topic for the young dental surgeons because dental implants are becoming very common, very popular, and now the patients know about it. And it is your duty to offer the patients this treatment. And again, it's your duty to know how to do this procedure. And I'm sure it's going to be a very easy and a comfortable practice and again, profitable as well. Now, when I started my dental practice in 2006 as a dental surgeon having my own practice, those days, even promoting a dental bridge was very difficult because you had to tell, you had to cut the teeth and things like that. But there was a time where people would come and say, I want a bridge. And then I saw the era where we had to promote dental implants to patients. Now we are in an era where patients come and ask us, I want a dental implant. So gradually for you, the practice has already been established now. So it's a matter of you getting interested in the field of implants and getting your hands dirty. So that's what we have to do. So this lecture, I'm just trying to motivate you to like dental implants and understand why you should practice this. And I'm going to give a little bit of information on certain things. So if there are people who are already practicing dental implants, they too might not find this a waste of time just waiting with me. I might run certain slides faster because I don't know whether all aspects I should mention here, but as I said, my interest is to get you to like dental implants and start practicing. So that's the intention. So this is George Washington. I don't know whether you know your history. This is the first president of America. But can you see that? Look at his cheeks. He has very bulky kind of cheeks, and he's always keeping his lips tightly closed. So if you check any picture, that is how it's going to be. But why is this? So this is the denture that he was wearing when he was the president. So obviously, he's very famous to have had a lot of tooth problems, dental pain, extractions, and this denture is now you can see this in in the Museum of New York. So this denture was made out of human teeth, wood, and animal teeth. And interestingly, it has a coil on the sides that you can see. It always keeps the denture open. So he has to forcefully keep the mouth closed. So what does this mean? The most powerful person in the world at that time didn't have any options, to have a better set of teeth. But today, I mean, most people uh, can afford a good natural set of teeth, and that is dental implants. So that is why uh, it's very important to know what is the best treatment because everyone deserves to have the best. So a guy called Brennemark, he was a scientist. He did some experiments on rabbits where he wanted to get the bone marrow from the rabbits. So he used a titanium cylinder. But after 3 months, he would sacrifice the rabbits and then reuse this titanium cylinder. That was his intention. But to his surprise, he found that the titanium cylinder could not be separated from the bone. That means it was stuck to the bone. And when he checked it, it has fused. So that's how the dental implants came to the world. That's about 60 or 70 years ago, not too long. And he started the first implants. So the fun fact is, the first implants he did was 60 years ago. And those implants also survived 15 years in the patient's mouth before the patient died. So can you imagine, 15 years ago, somebody placing the first dental implant, and that too survived. So uh, when you can see that dental implants do have a very good success rate. So what do you need to know in this? That's the most interesting thing. You have to understand that when you're trying to place an implant, there are a lot of things. For example, what kind of implants to select, how to select the patient, and how the treatment is done. So these things we will discuss in the next slides. So the question comes, if you're a beginner, what is an implant? So implant has few components where the implant fixture, which is made out of titanium, is placed into the bone. So this titanium is a very good quality kind of titanium, which is grade 4 or 5, which will osseointegrate with the bone. And on this implant, the tooth will be screwed in and fixed into the titanium. So that is the concept if you have not known what an implant is. So the price of implants, you would have seen that certain implants are very expensive and certain implants are slightly less expensive. That's depending on the grade of titanium as well. That's one factor. Somebody has raised the hand. Okay. You're going to ask a question?
Sir, shall we keep the session open for question like at the very end of the lecture? So that.
Yeah, sure. That's good. Yeah, thank you.
All right.
So the next thing that you should know is you would have heard about mini implants and conventional implants. Okay. So when I started dental implants, at that time, the mini implant was the most common and the popular because it was very easy. You just make a hole in the cortical bone and like a normal screw, you just screw it into the bone. And after that, a part of the implant, it's a single unit, part of it is outside, and then you take measurements like for a crown and bridge preparation. And then once the technician sends the crown, you just paste on this. So it was a very easy procedure, and still it is practiced for very narrow areas. But in a mini implant and in a narrow implant, the implant components are all in one unit. That means the implant fixture and the other part, the abutment part, is one component. Now we have the conventional implants. Conventional implants means the implant in 3 months on the conventional and mini. So mini narrow implants are very important. Space is very limited, and so the currently is not because it's very easy to remove the mini implant, and a conventional implant is totally impossible to remove if it gets into. Just a small introduction for you to understand these types, but I'm not going to go into details now. So with an implant treatment, the most important word is osseointegration. That means the bone and the dental implant, the titanium surface, will fuse together. So this surface is titanium, and different companies make the surface in different ways. It can have different shapes, as well as there's a thing called surface treatment. That means if we take the implant surface and sandblast it and put some chemicals on the surface, it will fasten the bone, healing it with the implant. Now, I'm just giving you different points so that you understand why certain implants are more costlier than the other implants, because they use superior grade titanium, and sometimes they use different technologies or methods to the implant so that the implant has a higher success rate. So those things make an implant more expensive. And also, certain implants which has been in the market for a long time, they have done a lot of research. So that too causes the implant to become more popular and more expensive. Another important word that you have to know in dental implants is a thing called primary stability. That means when you screw in an implant into the bone, it has to have a certain strength when you put it in. Now, if you remember, if you have ever made a hole in a wood and used a screw nail into that, okay, fixed a screw nail, you would understand how tightly it would be going inside. So we don't put the implant in such a tight manner, but it has to have a perfect fit, okay? So a very important concept is primary stability. Again, that's a topic of its own, but just understand it's very important. Now, this graph shows that as soon as we put an implant, it will have a good stability around because it is reasonably tight with the bone. But after some time, the stability goes down as the bone remodels around the tooth, and then it will become stronger again. So for this process, it takes about more than 8 weeks. So that is why traditionally when we put an implant, we wait 2 to 3 months for the implant to become stable inside the bone before we start fixing a tooth in that. So why do you need to no implants. Now, these are the bridges that we fixed 15, 20, 30 years back. So if you go to research, you'll find out that lifespan of a bridge is about 3 to 15 years. So all the bridges are failing now. So we have to give an alternative treatment for the patient. Bridge involves cutting the two adjacent teeth. Sometimes people do Maryland kind of wing bridges where food can collect if it dislodges. So it's not the best way to have a tooth. So in these people, you need to start giving dental implants as the most important treatment option. So I know that when you're starting dental implant treatment, there are a lot of barriers for you. First of all, you don't know about dental implants. You don't know how to do that. So the first step, you're listening to this, and you would have listened to a few other lectures, or you'd have read. So gradually, you're getting to know what are these dental implants. Believe me, it's a very easy kind of a treatment to do. You don't need much technical skills. A dental surgeon who can do a wisdom tooth surgery, who can do a transcellular extraction of a tooth, is totally competent to do a dental implant. But obviously, there are certain things that you need to learn. There are certain things that you need to get skills in, which is very easy to do. So you can get that. So the next barrier is the cost. You will have to invest on dental implants, the implant machines, things like that, the toolkit, and try to invest in a reasonably good implant when you're starting. I know that's why I told you, if you go for the cheapest implant, sometimes the failures and the problems might make you really demotivated. So think about what kind of implants you're using when you start the implant journey. So a patient will come to me and ask, why is the dental implant expensive? Now, when you talk about dental implant cost, in the dental faculty, we provide dental implants for patients. It costs 80,000 rupees. So that includes the cost of the dental implant and other material. Obviously, if somebody is doing in the private sector, they have to have a certain profit as well. And also in the dental faculty, you know that the labor cost is not added to the implant cost when they say 80,000. So obviously you will have to pay your nurses and the staff, so it's going to have more. So how much of a profit you're going to keep? So when a patient comes and asks how costly an implant is, there are a lot of factors which contributes to this. If you understand this, you can tell the patient why a dental implant is costly. So one is the type of implant, that the brand of the implant, and the location where you practice. Now, if you have a clinic in Kandy, sometimes your prices may be less because you're competing with the dental faculty and other practices. But if you're practicing in Colombo, sometimes the implant cost is going up to 350,000 or more. So that's how the market is. And then apart from these, your clinic, the standard, the quality that you're giving the patients. For example, if your clinic is having inbuilt X-ray facilities, a cone beam CT, if your clinic is having clinical records, all other the essential things that the patient needs for the treatment, then obviously the place will have a higher price. And also the experience that you get. Now when you start dental implants, obviously you'll have to go with a slightly a lesser profit because you're starting. But eventually you will see that more and more patients are coming for you. Your implants are becoming successful. You're keeping the records. and then you can gradually increase your charges because you are attending workshops, going for more investments. So that's how the final cost of the dental implant will fall. So again, there are 220 types of dental implants in this world. In Sri Lanka, I think there's about 8 to 10 types which are sold. But when you're deciding which brand to go for, think about the reliability of the implant based on how long it has been there, how many of your colleagues, seniors are using this type of implant, and then also see how user-friendly that is. You'll find certain implant types are very difficult to use in certain scenarios. Once you start getting used to these implants, you will understand the subtle differences that I'm mentioning. At this moment, you will not understand, but it is like driving a car. Now, if you get into a certain car, even a manual or a automatic, you will find the difference like this, and also how smoothly the car goes, how the gears change and things like that. And in implants, we need to tighten screws. There's a lot of mechanical parts as well. So the quality of these mechanical parts, how easily it fits in, all those things are very important when you think of the quality of a product. But sometimes you find the most advanced type of dental implant sold in Sri Lanka. But when you ask for a part, they say that they need to take about 2-3 weeks to provide that. That means the company or the agent has not invested a lot on the implant. So such parts, if you rely on such an implant, it might be difficult for you because the patients might want to go abroad immediately. So you can't take too long for the treatment. So finally, now you have decided on an implant, you have got a basic training, and you have invested. Now the most important thing is, how are you going to sell a dental implant? Because, one thing is that, doing a bridge is an easy thing. You get the patient, cut the 2 edges and teeth, take impressions, send off. So if you don't believe the good things about a dental implant, you can never sell a patient an implant because they will see it in your face. They will see how confident you are, and that is how your marketing is going to be. So if you are serious about it, I think you'll have to start getting everything ready and then start the procedure. But if you wait for patients to come and then invest on the implant practice, I think it's going to be much slower because the patients know that you don't believe in that. So once I went to a conference abroad, and in a research session, one guy got up and showed a research that they have done. And in that it showed people who have dental implants in their mouth live longer. Bit interesting, but that's what it said. So everybody came up and asked, "Are you serious? So why? What's the issue? How do they eat better? How do you say that people with dental implants live longer?" So he said, "No, the simple thing. Now, if you believe that you will live longer, you will invest on dental implants." So as soon as I came back to Sri Lanka, I got a patient, 54 years old lady, came with a partner, husband. And then I said, "You need 2 implants here." The patient said, "Oh, doctor, I will only live another 4, 5 years. No point in investing on this." Then I told her the story. This is what I learned. So if you think you're going to live only 4 years, that's all you're going to live. So best that you don't invest on anything. So after a day, they came and said, "Yeah, let's have the 2 implants." So That's what I'm saying. People who believe that they should have a good quality of life should have good teeth, so they will definitely invest on the implants. They know the value of implants. So this is what you have to drive to your patients. So let's talk about the basic things that we need to know or think about when we want to do a dental implant. Obviously, you have to find a healthy patient. You have to find the suitable candidate. That is a must. Otherwise, it's going to fail very badly. You have to plan. You have to plan before you put the implant, or else you will end up just wasting money, wasting time of the patient, and unnecessary treatment. A simple example for that is, now, if you put a dental implant thinking you're going to restore a tooth, and later you find out the opposing tooth has over-erupted into the space. What are you going to do? Are you going to tell the patient, I need to cut your upper crown and then do a root canal and then get the space? Now, if you plan that at the beginning, yes, you can tell the patient, if you want an implant, this is what you have to do. But if you don't tell that, then you end up having a big issue. Sometimes you have tilted teeth next to the implant. So if you put an implant, there's going to be a very unhygienic triangle between your implant crown and the next tooth. So these are bad things. So I'm just trying to point out, I can't tell you everything here. So just trying to, put your focus to an area where you need to see the occlusion, have a good idea how and where this implant is going to go and whether it will work. So that's good planning. And you need to assess the bone, obviously. Implant goes into the bone, so you need to find out the good bone. Surgical principles. Like I said, it's very easy, but even the madness has a method. So if you are going to do an implant, it's very simple, but there are certain principles. For example, good irrigation, which burst to use, things like that. Simple step-by-step guide. So you need to follow that. That's called the surgical principle. And complications can happen. You can't avoid that. But certain complications can be avoided if you think better. For example, one dentist told me he forgot. Now, you know that when we drill, the implant will be, the drill will be turning very fast. But when you want to put the implant in with the handpiece, then it rotates very slowly. Okay, you might understand this. So this dentist, he has forgotten to change the settings from the fast to the slow when he was about to insert the implant to the patient's already made osteotomy in the bone. So what happened? He turned the pedal and it turned very fast and the implant went flying. So he had only one implant on that day because he doesn't do a big practice. So he has only one or two implants. And then it went flying, and the patient also saw that there's nothing to do. I had to close it up. So that's a simple complication that can happen. But if you learn from others' mistakes and know where you can go wrong, you can avoid such a things. So yes, so this is an article where a dentist suspended, fined for doing dental implants on patients not suited for procedure. So I'm sure these things are not going to happen, but you'll have patients coming in and asking for their money back. So that's a common thing. So why waste your time doing implants if you don't plan properly and if it fails? So the traditional belief was that you can't do implants on patients with diabetes, those who smoke. But now people want dental implants. I mean, just because somebody's a diabetic, you can't deprive a person of a dental implant. But before you start, you have to tell the patients that there's a higher risk of failing for diabetics and for smokers, but yes, you can do this treatment. But remember, there are absolute contraindications, for example, radiotherapy and other conditions where you really need to take precautions like bleeding conditions and where the patient is taking medicines like bisphosphonates. Now, I have done dental implants on a patient who was taking bisphosphonates, but then we have to stop the drug for a period of time, and then we have to get the opinion from the physician, and then consent from the patient, and then do the treatment. So there are absolute contraindications like radiotherapy. Others are with caution, but always you have to discuss with the patient and understand the patient is consenting and understanding the risk of failure, if at all. So this is what I said. Smokers have twice the risk of failing an implant, especially in the maxillary arch. And the diabetics, if the glycemic index is more than 7 to 8, there's a chance of failure. But that doesn't mean every implant fails. So you can do implants on them as well. So the anatomy, the bone, everybody has bone, but the principle of putting a dental implant is that we need to have a very good bone cover around the implant. So three-dimensionally, the implant has to be nicely seated in the bone. And we have to keep a distance from the natural teeth and from two implants. So remember that this is important when we are doing dental implants. There are challenges, like you have the inferior nerve, you have the mental nerve turning upwards again, you have the maxillary antrum. So these are anatomical structures that you already know. So you just have to take care. This is not difficult. Now with cone beam CT, planning is very easy. And where you are going to put the implant, what's the length of the implant, everything is very easy to determine. So like seen in this diagram, we make sure that we keep at least 2 millimeters from the inferior alveolar nerve, because if you go closer, there can be heating up. You can accidentally push it in or drill the nerve canal and cause numbness. So these are the little complications that can happen if you don't plan your treatment. Same with the maxillary antrum, but what you have to understand is with cone beam CT, treatment has become much more predictable, much more easier and user-friendly for the dentist. We can easily cause perforations of the bone, sometimes causing a bit of bleeding. So understanding the anatomy, understanding how the bone curves, especially the lower anterior, that will help you to direct implants in the right direction. And also, now most dental surgeons use intraoral, these cameras, portable cameras, where you can, the X-ray cameras, which you can quickly take an X-ray and see whether the implant is going in the right direction. There are little complications that can happen. Everybody makes mistakes. So if you read literature, you find people who make mistakes, they collect their data and they publish. So that's how they become good researchers. So sometimes we get implants too close to other teeth, but that's not the intention, but sometimes it happens. This doesn't mean if if the tooth doesn't have any symptoms, the adjacent tooth, the implant will survive. But if it is a live tooth, sometimes the patient will get pain and problems if you invade into the a live tooth. And even if there's no symptom, if an implant is very close to another normal tooth, you have to make sure that tooth is not having a periapical infection or infection which can easily go to the dental implant. So these are little things that you need to plan. So if you're going to put an implant close to a tooth with a periapical infection, just understand your implant has a chance of failure. So things that you should look into. So here I told you, if the inferior alveolar nerve canal is close by, you have to be careful not to injure the canal. Other things, not going to go into detail, just to show you, the bone has different qualities. Some areas, especially the lower mandible, the bone is very thick. Upper maxilla, bone is very soft. So you're putting an implant, you will understand how easy it is to get this primary stability, or how difficult it is to get the implant to be stable in that bone. So once you start practicing, you have to know more details into this. So every implant that you know, they give a sequence of the drills that you have to use. You don't have to remember. Implant will have a drill kit, and they will tell you which drill to use and how the sequence goes. And also they will also tell you what's the speed that these drills should be used in. Everything is mentioned. You just have to go through the user guide of the implant system. There are different types of implants and methods to come around difficulties. For example, this is a very interesting phenomenon. This is called osteodensification. Now, on your right side, you see a small, picture where somebody's trying to plant a tree. When you dig the soil out, the hole, you make a hole, and then you can see the dirt outside. So what does that mean? Somebody has dug a hole, and all the dirt which was inside there is now out. So you have lost the dirt or the soil. So what happens in osteodensification is that that system causes the burr to turn in such a way that the bone doesn't get removed, but it gets pushed into the bone. So now you can imagine in a D4 kind of in a D type of bone where the space is very big. If you use a osteodensification burr here, all the bone will pack together and it will turn into something like type B bone. So that is a very useful technique when we want to expand a ridge, or else we want to do a sinus lift kind of a procedure where we want to use the extra bone. You don't have to go into detail, but just understand there are techniques that we can use when the traditional techniques cannot be used. So I'll give you more examples on that. Now, this is what I told you about osteodensification used for a sinus lift. Sinus lift means we have a certain height in the upper alveolus, but we want to increase so that we want to put a bigger dental implant. So what we do then, we use osteodensification, which pushes the bone up, and that will make the bony area. And also remember, if if you don't have enough bone, there are short implants. These, you can see the studies, they too survive a long time. Now, for example, if you get a 70-year-old patient coming to you and say, I want a dental implant to replace my first molar. And when you do a cone biopsy, you find the height from the ridge to the nerve is only 8 millimeters. So that means it gives you only a 6 millimeter space. So now, if you know that there are short implants, you can say, yes, I can offer you a dental implant. So short implant, over 1 to 5 years, if it's more than 6 millimeters, has a chance of 95 to 100% survival. But if it's less than 6 millimeters, still, it has a 86% survival. So there is a good survival, even though when we use short implants. Now, lastly, I'm going to tell you how we place these implants. Now, in surgery, there are 3 ways that we can put a dental implant into the bone. There's a thing called immediate extraction implant, where we extract a tooth and put the dental implant immediately into the socket. For that, the most important thing is there should not be any infection near the apical area. If there is an infection, we just let the socket heal for a few weeks, and then we can again try to do the implant. So that is called intermediate placement. That means you just wait for a few weeks to a month and then put the implant in. But the traditional, most successful, and if you're a beginner, the best way to start dental treatment, implant treatment, is as a delayed treatment. That means you extract the tooth, wait for 3 months, assess the amount of bone, and then do the implant. So this is a simple example. This tooth is removed, and into the socket, the implant is placed. So that's an immediate placement. Immediate placements are a bit technically demanding, because you can't just put the implant in the direction of the root. So you have to make slight adjustments. This needs a bit of a skill. So to achieve this skill, first, it's really good to practice the delayed type of implants. You can see that when you have a molar tooth removed, where to put the implant. Are you going to put it in the mesial root or the distal root or in the middle? So one thing is, this is prosthetically driven. Now, if you put a implant far away from another tooth, then how the crown is going to form. And if you're going to put in the middle point of the socket, that is technically demanding. But if you let this first molar extraction site heal for 3 months, then you will have good sound bone, and you can nicely predict exactly where your implant is going to be. So these are the disadvantages if you are going to put an immediate extraction implant. So some pictures to show that. And sometimes when we do in the upper teeth, bone loss is there. So then we do bone grafting and collagen treatment, and then the implant will be successful. It's good to do this immediate extraction implants in aesthetical areas. Then you get a nice gingival collar forming around the implant. So good for aesthetic zones. So this is what I told you. If there's a periapical infection, you will run a risk of implant getting infected if you put the implant in directly. But when you get more skills, you will understand you can clean this and then put the implant in safely. But remember, slightly higher risk of failure if you don't do the proper technique. So planning is becoming much more easier and user-friendly, because you have computer-guided treatment, so that when you keep a guide, you can drill to the exact place without thinking too much. You will know exactly what implant, what distance to drill. So this is going to be the future, and practice will be much easier. So cone beam CT is there for everybody now. You can very easily predict where you want to put the implant, the implant, and the so like I told you earlier, we measure distance from vital structures, very easy to do with the cone beam CT, and then place implants very safely. So it is very important to keep a good bone cover around the implant. It is not that, let's say that you want to put an implant into a molar area. There's no point in trying to put the biggest implant in with minimum bone cover. If you can put a reasonably sized implant and leave a nice collar of bone around the implant, at least about 2 millimeters, then the implant is going to be very successful. So apart from putting the implant, it's very important to have a good bone cover and a healthy gum over the implants. Usually, we try to select different sizes based on the site. Especially, you see that low sizes should have smaller implants. Smaller areas need bigger implants. So, generally, is the width half the tooth, but you can decide based on the bone volume. The length of the implant matters mostly when the implant is placed at an angle, like the anterior area, but in the posterior area, where the force is directly downwards, implant length is not very important. That means when you're trying to put an implant in a small area, trying to put a 14 millimeter implant doesn't make sense. You are going to compromise a lot of things. So 10 to 11 millimeter implant length would be the ideal if you can get that. But in the anterior area, sometimes you might use 13, 14 millimeter implants. So the best practice is the delayed placement of implants. So I'll just drive you through some tips here. You have to give anesthesia. If you're going to raise a flap, make sure anesthesia stays for a longer time for the anesthesia to diffuse inside. You just give anesthesia supraperiosteal, and within few seconds, if you raise a flap, the anesthesia has not gone into the bone. So as soon as you start drilling, the patient is going to get pain. So make sure when you raise a leave anesthesia for a long time for it to nicely diffuse inside. Is a bone. Traditionally, we the two teeth, but now it's very much easy if you cut the you hold the flap on with your retractor, and you get good access to the bone ridge. If you make the cut in the middle, you'll have to retract both the sides. So that's going to be a bit difficult. And then we have the physio dispenser, giving a lot of cool saline. If you can cool the saline, that's better. And then we can use a round burr to smoothen the alveolar ridge before we start. And then we have the first drill, which is a pointed drill, which will make a hole in the cortical bone. And then you can use things like the guide pins. You can take x-rays. You can see how the angulation of the implant, you're drilling, now you have started drilling. From each stage, you can see which direction you're going and to see whether you're in the right path. So after that, just follow the drilling guide based on your implant that you're going to put. You can use the speed of the handpiece depending on the instruction by the manufacturer. So it's important to have a good machine which is reliable. So it's going to be a bit costly when you invest on this, but it's a must if you want to do dental implants. But there are certain companies that they will rent out these machines. So that's also a good option. Each implant is different. How it is boxed, how it is fixed, it is different. So one important advice that I want to give you is, before you do on an actual patient, please get to know the implant very well. How to open the box, how to take the implant out, and just go and see that with a person who's using it already. And also, now there are a lot of YouTube videos where you can go and see how these implants work. Otherwise, believe me, if you don't know, you'll be struggling how to use this implant, because each implant has different, simple technicalities that you need to know. Otherwise, in front of a patient, if you try to, look confused and trying to sort out how to do that, the patient is not going to be very happy. So this is one type of implant where you have to unscrew this part, the top part, and remove the green part after placing the implant. So end of the surgical part, once you put the implant into the bone, you have to either close it with a cover screw, or else you can use a healing abutment. So that depends on how you want to proceed to the next, the prosthetic part. But understand, if you're going to put a healing abutment, you have to have a good primary stability of the implant, otherwise it will fail. So a nice healed implant with a healthy gingival color, that is our objective in the surgical part of dental implants. Okay, I'm finished with what I have to say today. If there are any questions, happy to answer.
Thank you very much, sir. I think you even finished it. You're in time with that, with your lecture, and we can allow the participants to unmute themselves and ask questions. So I'll make that option available. Right. So if you have any questions, you can go ahead.
People who raise their hands have fallen asleep, I
Yeah.
think.
No, I don't think so, because we have a quite like a steady number of participants, like right throughout the lecture. So even more than 100. So I think it was quite interesting as well. So I just wanted to ask you now, there are dental surgeons who are currently practicing in outstations, like who do not have access to it. Sometimes they might not be even doing private practice in their first appointment in the government sector. So for such dental surgeons, how would you like, rather than getting their knowledge uplifted by listening to lectures as such, uh, to make sure that the skill level is kind of geared up to this level to place implants? What sort of other activities could be done, sir, whether to use the mannequins or using some other methods to upgrade themselves?
Yes, so there's this interesting proverb saying, if you hear, you forget, if you see, you remember, and if you do, you know. So I think it's now very easy to see because YouTube, so many channels are there. You can, see better than observing in a live surgery. Lot of implant workshops are there for very smaller prices, and I have been to those, and I see a lot of dentists from different parts of the country coming and wanting to do. So if you have not done already, that's a good opportunity. Yeah. They give you hands-on training on animal bones and models, so you actually get the basic skills on doing it.
Right. So we have a number of questions in the chat box, if you can see. Uh, so today our lecture is not sponsored by any of the implant brands. So there's no any conflict of interest as well, sir. Now they're asking some questions about the brand of dental implant.
Diabetic patient, what's the best brand in Sri Lanka? So like I told you, there is no best brand, but I told you how you should find out whether something is good or not. So find out how many people in this country are doing that implant and ask them what they experience, and you will see, for example, if you look at the dental faculty, what are the brands they're using there, and other hospitals, other clinicians, and then you can ask the advantages, disadvantages, things like that. But basically, if all the implants are titanium, so they all have a good success rate. And I don't think the implant type has an effect on diabetic and prognosis. But I don't know, maybe a better implant may have a better success. Yeah.
And Dr. Tushar is asking about immediate loading.
Yes, so immediate loading is currently becoming more popular. I didn't mention that because this I thought is for the beginners. So immediate loading means we put the implant in and then we fix a crown within 1 to 2 days. That's the best time to put the crown in because once you put the implant in, the bone starts remodeling and the implant will get loosened. So before that happens, we have to take impressions, fix the crown on the implant. As you know, we have to get a good primary stability before we do the immediate loading. And immediate loading is also, even though it says immediate loading, we keep it subocclusal so that it doesn't get a big load. And also instruct the patient not to bite on it for about 3 months. It's becoming more successful. People are demanding that. So yes, but if you're beginning dental implants, I don't advise you to do that at the beginning.
So
Can I come in here?
yes, please.
Thank you very much, Dr. Nadeena. It's a very informative lecture. And my question is that if the top part of the alveolar crest is oblique, it's like pointed down, and then when you drill hole there for the implant, how do you design it? Whether it's go up the maximum depth of the top part or the middle part? I don't know if you can understand my question. If the top part of the alveolar crest is having it's not pointed, maybe in a slant. How do you drill the hole there for the implant?
Yes, I don't know whether I understood your question correctly, but I will paraphrase. I will tell what I understood. So you are saying that the implant ridge may be narrow at the top and wide at the base, which is mostly how it is. And you are asking how do we know when we insert the implant, whether it can be inside the bone correctly.
I think that was Professor
Is
Vijay who joined, I think. So. Yeah, I think that was the question. Yes.
That's a question.
Yes.
Okay. So first we assess with the cone beam CT and see what is the amount of bone which is there. Let's say that the bone is 3 millimeters. Okay. So if the bone is 3 millimeters at the crestal level, then you have to put an implant which will be very small. So in that situation, maybe a mini implant would be very narrow, but still the narrow implant is 3 millimeters. So it's not practically possible to put an implant into a 3 millimeter ridge. So then if you want to put, there are a few things to do. One thing is, if the top part of the ridge is like a knife edge, maybe you can trim that part and get a wide area at the bottom. But then your crown is going to become lengthened, and where the implant is going to project is going to be slightly subgingival than the other teeth. So that may not be your best option. But the best option would be to widen that ridge. So that's what I told you. The osteodensification burrs are very useful in such a situation. If there's a good cancellous part of the bone, you can't expand cortical bone, but if there's a cancellous part, we can expand the ridge and put a 3 millimeter implant with safe bone cover. The next thing that you can do is a thing called the ridge split, if that is a cortical bone. That means we cut the ridge and then we split it and insert an expander into the area so that the bone will split and cause space. And then we put the implant in, put bone graft and cover it. So those who are new to dental implants, these things may sound alien to you, but don't worry. First, you know the basic things. The rest is you can easily overcome these challenges. It's very rarely that we would tell a person that you can't have an implant.
Thank you, Dr. Now, my question, I think you could understand it very well. Now, say for example, you can't flatten because then you reduce the height and it's
Yes.
having a slant
Yeah.
shape. My question is, how do you now? The one side may be high, other side will be lower. You better to flatten it. If you just place the implant, how do you place?
Yeah. So one thing is that if you put the implant, if you find it's coming out, the threads are getting exposed in one area, then you'll have to put a bone graft and then put collagen and things like that. But ideally, identifying that early, maybe doing a bone graft initially and widening the ridge is something that would be good. Or else, even with different, you have to expand the ridge. You have to make the ridge bigger if you want to have the best, most successful, most aesthetical implant. For that, you will need to go for bone grafting before you do that. But if the patient is very demanding, then you might try putting an implant and then covering the exposed thread with bone graft, collagen, and closing it up and keeping it. But the chances, if the bone graft fails, the threads will get exposed and things like that is there.
Thank you, Professor Nadeena. Now, there are cases that we notice that even though we have enough thickness of the mucosa or the maybe gingiva, the time when you recall the patient that top part of the implant is likely exposed before you insert in the healing cap.
Yeah.
During the 3 month, yeah. How do you manage those cases?
So if at the initial stage, you can do a gingival grafting in that area. Bone grafting will not work ideally. So you can raise a flap and then you can put soft tissue graft into that area and get the threads covered so that will be more aesthetical. I have not attempted bone grafting in such situations, and I don't think it will work at that stage. I don't know about your experience.
Right. Thank you very much, sir. Thank you very much for the question. So I'm not sure whether you can see the chat box, sir. There are some interesting suggestions for the future lectures, so we'll definitely take those into consideration. And Dr. Pushpa is asking the question about selecting the diameter of the implant. I think you covered it in the as well. If you can just summarize for the sake of the question that was asked.
Tell me again, please.
Dr. Pushpa has asked about the selection. How do I select the diameter of the implant?
Yes. So diameter of the implant has to be selected based on the anatomical area you want to put the tooth. For example, if it's a lateral incisor, you can have a very narrow implant, 3 5 implants area. But if you're going to put an implant into a molar, it would be good to have about a 4.5 implant. So like I said, the natural diameter of the tooth divided by half is the usual equation to think of the diameter. But again, people are understanding more that just trying to have a bigger implant with minimum bone around the implant is not going to be successful. So it's a balance where you have to get a sound bone cover around minimum of 1 millimeter and selecting the optimum implant. So I work with another colleague who does the prosthetic part because I do the surgical aspects. So when I'm supposed to put a narrow implant into a molar kind of area, I talk to my colleague and then he tells whether he's happy with putting a crown in such a implant. And if it is not, and then we had to discuss with the patient what are the consequences, how big the crown you're going to put. Sometimes if you put a narrow implant in a lower 6, you might put the crown more towards the 5 and leave a gap between the 6 and the 7. So these are the prosthetic sides that I have heard my colleague explaining. So I'm not the expert for that, but so like I said, the amount of bone, the tooth that you're going to replace are the main things when you consider diameter. But if you have to compromise on diameter, you have to have a good idea of the prosthetic outcome.
Right, sir. Thank you. So we will entertain maybe 2 or 3 more questions and we'll call it a day, sir, if that's all right with you.
Yeah, obviously.
Right. So Dr. Surega has asked this question. What are the factors that we should consider in a patient with rheumatoid arthritis?
Now, the thing is that the basic things, if a patient, the rheumatoid arthritis is not affecting the bony area of the implant, but what is the patient currently on the medication, whether the patient is on steroids and other immunosuppressants, those things would affect. And apart from that, the disease itself on the bone area, I don't think so.
Right. And there's an interesting question by Dr. Rajidir, and he's asking that he missed the first slide of the lecture. He was asking whether, can you repeat the quote that you mentioned at the beginning of the lecture?
The Brenner Marx quote, is it?
Yes, I think so.
Yeah, it mentioned that nobody should go to sleep with their teeth in a jar of water. That means the traditional way of the dentures, you keep it in the night in the water. So yeah, that's a good quote. You can put it in the dental practice.
Indeed. Right, so we can entertain maybe one more question. If anybody is willing, you can unmute and ask. So as we kept the audience informed that this is a lecture that will be open for the experts as well as for the noises, we found a range of dental surgeons joining with us. We found professors, even Professor Vijayaratna did a wonderful workshop with us with the dentistry team on endodontics recently. And even Professor Dilip is also here. So maybe he might be able to find a more economical method of making dental implants available in Sri Lanka after listening to the lecture today, sir. So on behalf of dentistry, which is the academic arm of Government Dental Surgeons Association, I'd like to thank Professor Nadeena Jayasooriya for accepting our invitation and doing a wonderful lecture. I'm sure it was an eye-opener for most of the dental surgeons who are new to the practice of dental implants. And we would actually be giving you a certificate of appreciation, which I will personally come and hand it over to you. So I would like to thank all the participants for being actively engaged in today's lecture. And we look forward to have a number of lectures on dental implant series. And hopefully the next lecture will be on the CBCT and about patient planning, the treatment planning of the patient before going on implants. So that will be done by Professor Ruan, and Dr. Dhanushka Bandara will also be doing another lecture. So stay tuned. And we'd like to make sure that these recordings are available for you to freely access. Within the course of next week, we will be able to make sure that these lectures are available in our YouTube channel. So thank you very much, sir.
Thank you very much. Good job. Okay. Good night, everyone.